Alrighty, good evening, everybody. Thank you all for joining us. We are really excited to offer this community workshop to you all. Um, and we have our amazing ambassadors, Edward and Anthony, who are going to be talking about stakeholder identification, research questions, and hypotheses. And I will let them take it away.
All right. Thanks, Dorianis. Hi, everyone. My name is Anthony. A little bit of an introduction. I'm a fifth year now PhD candidate at the University of Arizona who specifically studies how plants change within urban environments. And yeah, Edward, if you want to introduce yourself.
Sure, thanks. Hey everyone, I'm Edward. Right now I'm a research tech at Boston Children's Hospital. I do mostly immunology research, and I'm really excited to get to know you guys better today.
Awesome. So what we're going to be doing today is discuss with you all kind of the scientific method process. So this is going to looking at the specific more individual portions of the scientific method, what you would expect a kind of traditional scientific method process to look like, and then also individually going to your own your own projects and kind of breaking down what are your own specific scientific method processes that would be adherent to your own individual studies. All right. And with that, we'll go ahead and get this started. A couple reminders for just OFIS related news. Each module builds on what you've already learned today. So much of module 3 should already be done up to this point. And also your work on modules 1 and 2 are parts of module 3 and will be revisited for future modules. So just a little bit of housekeeping for that really quickly. So, as I briefly mentioned, the agenda today is going to look at the scientific method, specifically what are the different portions of it and how they may relate to your own scientific discoveries and processes throughout OFIS. And this is going to include identifying stakeholders, decision making, or makers, and your audience. And we'll go into a little further discussing what those means in regards to your own projects. And then finally, writing research questions on why they are important and how are the best way to write them. And then also generating testable hypotheses related to your research questions. All right. So we'll start very broadly with discussing what is science in general. And the definition that we're going to be using for this discussion is that science is the pursuit and application of knowledge and understanding of the natural and social world following a systematic methodology based on evidence, which is essentially saying science is a method that we use currently to understand how the natural world and social world work. And this is done in a systematic methodology known as the scientific method. And there are different portions of the scientific method, and they are broken down in these different ways. So we'll just start with just the different portions of them. So starting with an observation, question, hypothesis, experiment, results, and conclusion. Now, let's break this down into what each of these individually may mean. So, to begin with an observation, this is a very broad kind of information gathering portion of the natural world, the social world, understanding certain patterns either visually, audibly, using other senses to kind of notice certain things that are happening and potentially pattern. And that is the kind of beginning portion of the scientific method, noticing what specifically is occurring in the environment around you. And from there, those individual observations, such as noticing that there are invasive species, which are just species that were introduced accidentally or even purposefully outside of their natural environments, are taking over the Indian River Lagoon. So that is the initial observation. We're noticing that these species are starting to inhabit this individual area. Now, the question following this observation would be something to pertaining of the whys, the hows, the wheres, something that is trying to understand better of why this phenomenon is happening. So, the question in this retrospect would be, why are invasive species taking over the Indian River Lagoon? So we have our initial observation, which is just seeing that there are invasive species in this area. And then now creating a question that is, why are these invasive species taking this area over? And then from there is something that we would come up with called a hypothesis. And the purpose of a hypothesis is now trying to create a narrative that explains the phenomenon happening. So we have our observation and our question, but now we want to explain the hypothesis of essentially why we think this is happening. In which case, our hypothesis for this scenario is that native fish will survive better in lower water temperatures than higher water temperatures, while the opposite will be true for invasive non-native fish. Now, this is a hypothesis specifically looking at invasive species in general, but we can also tailor a hypothesis to our specific question, such as if we were to look back at why invasive species were taking over the Indian River Lagoon, we can also ask a hypothesis is that we believe that invasive species are more suited to these environments than native species. So it is almost an explanation for your question that the hypothesis is trying to serve. So we have our observation, which is the knowing what is happening in the natural world around us, devising a question based on those observations, and then having a hypothesis, which is almost an explanation for that question that we are now asking. And from there, we want to devise an experiment to test this hypothesis. And ultimately, your hypothesis should be falsifiable, meaning that we can either prove that it is true or that it is not true at that current time. So an experiment will allow us to do with that. And in this case, this experiment would be, let's grow native and non-native fish from the Indian River Lagoon in multiple water tanks that are exactly the same except having different temperatures. Our non-native fish surviving better than in warmer tanks. So ultimately, this experiment is trying to look at how the native and invasive fish are doing within same conditions, so having a control of some kind as well. And this will ultimately help us answer the hypothesis that will native fish survive better in lower water temperatures versus higher water temperatures. From this experiment, we would hope to get results that will help answer this hypothesis. So after a week, there are fewer native fish and more non-native fish in the warmer tanks, thus are coming up with a answer whether or not our hypothesis is true or falsifiable. And then having a conclusion, which essentially has us look at warmer temperatures are impacting the ability of native fish to survive while promoting the survival of the non-native invasive fish. So that was a lot of information very quickly. So to kind of recap on the overall goals of the scientific method, you start with your observation, which is something that you notice within the natural world. You come up with a question based on those individual observations. A hypothesis is then a explanation or towards the phenomenon that you're noticing based on your observation and overall question. You devise an experiment to test that hypothesis, which again should be testable and falsifiable. And then you would come up with results and conclusions that will either prove or disprove your hypothesis. Does anyone have any questions about those different portions of the scientific method before we move on? Cool. All right. So let's work through an example again together. So let's say that we're working at a hospital that has recently been bought by a private equity firm, and you feel like you're seeing more patients returning with their existing problems. So that's our observation. We are a member of this community who may frequently be having access to this hospital, maybe just be walking by it every day, maybe having a certain job near it. But overall, this is an observation of noticing that we are tending to see that more patients return with existing problems. That is the initial observation within this potential scientific method. So, based on this observation, what are a few questions that we can ask from this? Some that come to mind is that are these patients result that are coming with existing problems part of the overall are part of a certain portion of the city? Are they members of a particular race? Are they members of a particular age? Things like that that might be relating back to the initial problems of the kind of medical phenomenon in which you're noticing that is based on your individual observation. And then from there, we then can come up with our hypothesis. So we may notice that potentially that people, let's say that we wanted to see if are people at a particular age returning to this hospital with more existing conditions. And a hypothesis that we can come up with that is that we expect age to be an impacting factor on whether or not patients are going to be returning to this hospital or not. And then finally, an experiment to test our hypothesis would be doing a systematic approach of maybe a survey or another form of data gathering to determine whether the age and pre-existing conditions are correlated with one another or have some sort of relationship. So we have our observation, our question, our hypothesis, and our experiment. So we have this portion of the scientific method, which is the very foundational, very physical elements of science itself, but it's not going to be the only factors when devising a experiment in general. And what do I mean by this? Oop. There's going to be individual members of the community, of society, of government that are ultimately probably going to be impacting the outcomes of this experiment, the goals of this experiment, and even the funding of this experiment. And these are labeled in particular individuals to begin with, stakeholders. These are people who are or should be included in making the decisions. So ultimately, people that either might have the interests of the people being affected or the entities of those being affected. The target audience, so who is being impacted by the issues of your research, who can address and solve the problem. So individuals, whether that is humans, environment, species that are ultimately going to be impacted by the overall findings of this experiment. And then finally, the decision makers of who has the power to make and impact decisions. So ultimately, who will be able to once they see this data collected from this experiment, be able to enact meaningful change in response to the results that you get from that experiment. And these are just kind of generalizations of the people that may have influence in your experimental design and also the outcome of your experiment in general. So, this is extremely important within the scientific process, which is a less so on the scientific portion of things, and such as figuring out an observation, question, hypothesis, and more of the kind of social aspects of your experiment. And this is important because we are ultimately trying to come up with these studies to better the society around us, whether that is at a very community level, could be at a county level, or even maybe at a nationwide level, and to integrating all these individuals into a particular area and understanding who is going to have the power to spread the findings of your experiment, to fund your experiment, and also make sure that people have the most meaningful um, benefit from your experiments in hand. And this is why asking these questions are ultimately important, just as important as coming up with your scientific process as well. So, for stakeholders, this could be colleagues, supervisors, regulators, and funders. So ultimately people that either will have some economic or academic incentive in terms of helping you create this study. The decision makers could be supervisors, the university departments, program coordinators, collaborators, that kind of more administrative level. So less so, more so on the academic side and more so on the higher up kind of policy making of the institution. And then finally, the target audience would be a group of people in a specific income group, ethnic group, age group, colleagues, and peers. And ultimately, this comes in together of just deciding what your experiment's going to accomplish, who is it going to benefit, and ultimately who's going to be in charge of it slash funding it. So let's try this really quickly. I don't have any local parks, and the local streets don't have any trees. Who is impacted by this issue? And I'll hand it off to Edward to kind of facilitate some of this dialogue right now. So let's just start with the audience right here and based on this scenario, who would be impacted by trying to understand that you notice that you don't have any local parks and local streets don't have any trees? Who would be impacted by this issue?
Thanks, Anthony. Can you just like pause your screen share and just like leave presenter mode and redo presenter mode? Thanks.
Yeah.
And then share your screen again.
I was gonna say, for stakeholders, maybe the local wildlife, especially like a bird population when we're thinking about trees.
That's really great. Thanks, Tess. And anybody can feel free to speak up too. I also see, oh, go ahead, sir.
I was going to say, can everyone see this okay?
Yeah.
Cool.
And then Ishan, feel free to also speak up if you want. You put down in the
换个 AI 配音啊，你他妈那个原声听起来
Oh yeah, I also put that you would be impacted, people in your neighborhood would be impacted, and also like Tess said that native species to the area would be impacted because they do not have any habitat to live in.
Yeah, thanks. What's an example of how people in the neighborhood might be impacted?
Through mental health, like if there's no like there's been many studies that show that spending time in nature can improve mental health, and staying in like concrete jungles can decrease your mental health. So if it's like that, then people who live there, their mental health will be impacted.
Yep, absolutely. Thanks. And I think Araceli, I hope I'm pronouncing your name correctly, said something similar with general residents. Do you want to add anything?
Same thing, like within the same direction that Ishan was thinking, but I guess to add to it, maybe like it also affects the physical wellness of the residents.
That's true. Thanks. So there's both mental components and there's physical components to this, or that's potentially what you're hypothesizing. And then the next bullet point, when Anthony gets to it, would ask who can help solve this issue? So who would you want your capstone project to reach? Anthony, if you want to click to the next,
Yeah.
thanks. So what are your thoughts? Like if you were like, okay, this is my neighborhood and I don't really see any trees in my neighborhood, and you want to do a capstone project about it, who do you want to sort of reach with your efforts in your capstone project? And again, like feel free to just shout something out or raise your hand, but you really don't need to, or put something in the chat. And there really are no wrong answers here. Hey, Sophia.
I think those who could help solve this issue would definitely be the ones that are directly impacted by it. Like, if we are the ones who are going to the street, I think for the first people to kind of be like, okay, we should probably make a change to this. But those who have actual like change making power would probably be the ones who are with the state. Usually the ones that are with recreational, like the ones that are like specifically with recreation and public like infrastructure. It would probably be just like I don't know if there's like a department for that, but probably like people who work with um that. But definitely we'll start from us first, making a complaint, and then it would then go up to them. Because I don't think they'd be strolling around looking for that.
Thanks, Sophia. I think it's interesting that you're mentioning officials at the state level. Can we get some more thoughts from people? Like, you are really, really smart people with just lots of ideas, and we really want to hear them.
Um, maybe city planners. I guess that also ties in with Sophia's idea.
Okay, can you elaborate on city planners? Like, why would you say that? Like, what do you think that makes you say that?
Well, I'm particularly fond of like um agriculture, like urban environmental planners, where they kind of rework the stagnant concrete cities and just add or like take out parts of the road to like add like those greenery parts, and that's what I was thinking.
Okay, so you're saying potentially when city planners are thinking about roads, they can put in more concrete or trees? That's good, thanks. Anyone else want to share thoughts? I'll give you maybe 10 more seconds to chime in here.
I think oh, sorry. I was thinking along the same lines as what everyone else has said, but also I'd like to like really emphasize like local communities have a lot of say in what goes on in their area, and even if there's just like an apartment building and they like come together and like try to talk to like like the organizers of the apartment, for example, there could be like more trees or something just in that smaller area, and that would still make like a significant difference just by changing the environment a little bit. It could also like set off waves of change throughout the entire community as a whole.
Thanks. How do I pronounce your name correctly? Is it Safane?
Yeah, that's actually perfect.
Okay, cool. Thanks, Safane. So you're saying that like somebody in maybe a small neighborhood could organize. And when you say organize, what does that sort of mean, potentially?
Well, there's lots of like, I think even someone did a project for OFIS, and that was like an example project where there was like the small tree planting project in like at their school or something, and just small things like that can happen pretty much anywhere that's like not public property. Obviously, public property you'd have to go to like local governments, like everyone else was saying.
Thanks, Safane. That's awesome. Thanks. And I promise that we did not copy that project when we were making these slides. Thanks. And then Sai, I saw you put something in the chat. Do you want to say what you wrote or add on to that?
Sure. I kind of actually in the same vein that Stefani was talking about with like local communities having some say. I also know there are some nonprofits that people can sometimes reach out to that are aimed at like planting trees or holding green days or things like that that might be involved in, you know, planting trees on local streets. And as far as parks are concerned, I also know that like local parks and rec departments also have a say in where they can build parks, and that can range like the type of parks they can build and what facilities they can put in, as well as also being able to put like, you know, park rangers and things like that. Like the actual upkeep of these things would have to deal more legally with them. So if there were someone to advocate in a more bureaucratic way, it would probably be them to help kind of solve the issue.
Thanks, Sai. I really appreciate that. That's great. So I think what we're getting from just everybody sharing their thoughts and their viewpoints, which is really appreciated, is that there actually are a lot of ways that you can try to solve this particular issue, and that there are a lot of different people potentially that you might want your capstone project to reach. State officials, local officials, on the city level, I guess, with Parks and Recreation or with urban planners, and also with just regular people in the community who aren't necessarily government officials. And so that's just something to think about as you work on your capstone projects. And then if you go on to the next one, Anthony, thanks. We want you to think about who you want your capstone project to most reach. And then we can move on to the next example here. So here's another example that we have for you where your community maybe doesn't have so many hospitals. And again, we'll ask you to think about these questions of number one, who is impacted by this issue? And Anthony, you can also click on to the next bullet point.
Yeah.
Thanks.
I'd say like, well, obviously mothers first and foremost, but like everyone has a mother, everyone has that sort of association. But so like you are also hurt by your mother not being able to have that proper care. So like a lot of the community is impacted by that. And this may be a stretch. However, like it is like if they don't have the proper care after C-section, perhaps they don't have the proper care after like a lot of other operations as well. So it might be like important to look into like what other people are being affected by other operations as well.
Thanks, Safana. That's really great. So I realize that the question does mention C-sections, so that's a really great answer. Thanks. Any other thoughts? And also thanks for mentioning that there could be definitely be impacts outside of just care that they provide to people in pregnancy.
So I just want to add, I'm not sure if you guys will talk about this, but when it comes to the scientific method, I didn't
Yeah.
learn about stakeholder engagement. That wasn't really a big part of the scientific process, right? So it is so valuable that you guys are engaging in it and thinking about it, because the question was often not asked of like who's impacted until the end in the discussion of the write-up or something like that. And so what we call is like parachute science was very common. And so someone would come to the area and they would study and they would see that there's not hospitals within 30 minutes, but the actions, the solutions were not there. So by thinking of all the different stakeholders, we're able to give very meaningful action potentially, right? And in this case, it could potentially save lives, right?
Thanks a lot for mentioning that, Angie. Absolutely. Zoe, I hope I'm saying your name correctly. You put something in the chat. Would you want to share?
Yeah, sure. And you said it correctly. It's Zoe. I was just adding that families without access to a car or good public transportation would be disproportionately impacted by this. Like, it's obviously hard for all the local residents that are in that area, but even harder for people who literally can't travel or can't afford to travel.
Absolutely. Thanks a lot. So people who have a hard time traveling, and maybe people tend to have even harder times traveling when they're pregnant. Araceli, I also hope I'm saying your name correctly.
Yeah, you're saying my name correctly. I was
Oh,
thinking really hard about the C-section one, and
okay.
one thing I thought of was like premature birth, like how dangerous that would be. Like
Yes.
how um more I read this from an article how like more um babies born have higher mortality rates because of like inefficient C-section procedures or like inefficient post-birth procedures. So that the fact that like this hospital doesn't have that good of a care means that the infant mortality rate would probably get higher.
Thanks a lot for mentioning that, Araceli. And I also appreciate how you introduced this time critical element where in certain cases, for example, certain birthing situations, it is critical that you receive timely care. And 30 minutes away is not very timely. And it also reminds me that there are basically a whole variety of other conditions where it is very critical that you get treatment as soon as you can, like stroke, which I think you might hear talk about a lot in terms of different signs and symptoms for it. And I'm just searching this up right now, so like I don't have it memorized, but there are scientific articles that say that you lose 1.9 million neurons a minute every time for basically every minute that your stroke is untreated. And so having a hospital, or another example is maybe a trauma center, and trauma centers also come with different levels to them that can deal with different severities of cases. And so having these hospitals just be 30 minutes away, even any situation, is just generally not that great. And I will move on to the next question here, which is who can help solve this issue? Thoughts? So if you were working on a capstone project about, let's say, a lack of hospitals in close proximity to you or your neighborhood, who would you want to reach with your capstone project, maybe? Thanks, Veronica. I see you put something in the chat, and you actually mentioned two different groups of people. Would you want to expand on that? And then Sai will come to you.
Sure. I'm not sure about the second point, but hospitals are like managed and I guess yeah, managed by like government officials. So in order to help solve this issue, we would probably have to go talk to them and like kind of advocate for better um like better provisions and that kind of stuff. And also like biomedical companies, because when you're performing a C-section, you need like a lot of tools, I guess. Well, I'm not very familiar with that, but um, if we tell these biomedical companies like that we need more of these materials, then it would probably also help solve this issue.
Okay. So I guess potentially you could have companies provide maybe better equipment or better training in terms of using equipment and new
Yeah.
technologies that can help them provide that can help doctors and nurses and other healthcare workers to provide better care. And then what you mentioned, government officials, is also sort of interesting. I think, or actually, I'll let Sai, you want to chime in here or share your own thoughts?
Sure. I was gonna point out that both of these issues are kind of solved by the hospital being able to provide, an ambulance or better materials is usually a lack of funding or allocation of funding. So I think for a more concrete solution, reaching out to the hospital, and then if there are funding issues with the hospital, maybe looking like nonprofits could probably provide some way of developing funding or donating equipment or things to try and help that, like like what Veronica said about biomedical companies offering those kinds of treatment and facilities and equipment would be better if they were the hospital was able to afford them. And maybe this is like a low income area and they just don't have enough to have this equipment and have an ambulance be able to come and have like better hospitals that are closer. So it would be I just think more imperative to like have a nonprofit or someone just do like a charitable act of like giving them money or the equipment they need. And I think that would help solve the issue.
Thanks a lot for mentioning that, Sai. I really appreciate especially how you brought up the EMS component. Like maybe if you're parking all the ambulances in one spot, this is just worsening the problem because now the ambulance has got to get to you and then you got to get to the hospital. And so maybe you can encourage an EMS company to, for example, station ambulances in more discrete places. And also, thanks for mentioning that about nonprofits. Korea, I hope I'm saying your name correctly. I also see you put something in the chat. Do you want to expand on that? It's okay if not, I guess. Okay, yeah, and I guess one final thing that I'll mention about government officials is that I believe, and this might be a bit into the woods, I believe that they don't really set the locations of hospitals and medical facilities at a national level, but maybe they might be more involved in terms of local politics. But then what Sai mentioned with funding is really important. Like a lot of hospitals get funding from government insurance like Medicare and Medicaid. And so if the government sets different reimbursement levels, they might encourage more hospitals to either operate satellite facilities or maybe closed facilities. It works both ways. And so we've had people mention some really, really important groups. Thanks. And then you can click the next button twice, Anthony. I want you guys to think about how the two audiences, so if you remember the earlier question about not having any local parks in your neighborhood, and then this question about not having any nearby hospitals, how are the audiences different or similar? And I'd really encourage you to either just say something or put something in the chat. Thanks.
Uh, Wait, just to clarify, when you say two audiences, who are you referring to?
Got it. Thanks. Sorry. Audiences that you want your capstone project to reach. Thanks for asking that. That's a really good question. Thanks. Araceli?
Well, we have two separate problems that I presume impact like there is a difference in like who they are impacting, but I noticed that the ways that we could solve these issues were like very similar. Like we were talking a lot about funding and like talking to officials, like government officials, and like that have the power to solve these. And it all just boils down to like maybe changes in policy, maybe more funding, maybe more like advocacy and like the grounds that we do need these um areas to be built for like general resident and like patient wellness.
Thanks, Araceli. I appreciate that. Anyone else want to share thoughts?
To add on, I just want to say that like if you were to go to the government, that's a much more like public process than going to like privately owned companies and such.
Yeah, thanks. Okay, so just to keep things moving, I guess I would say that capstone projects, of course, you're in control of your capstone project. You get to choose sort of who you would want to primarily tailor your capstone project to, in a sense. You can definitely want to have more of a policy angle where you're trying to reach some sort of official at whatever level of the government. You could try to have a more informative aspect to your capstone project, maybe if an issue isn't that widely recognized by people, and so they just don't know that it's happening or that it's important. Maybe that's something you can try doing. And so we would just say to just think about these things, and of course, definitely talk with your group, talk with your mentors about them. And then, Anthony, if you want to click the next button twice again. So now we'll be talking about basically designing a research question. And as you're designing a research question, I'd say probably one of the first things that you want to think about is just what you want to focus on, of course, which I think you all would have chosen capstone topics by this point. And then we want you to think about the connection between science and social justice for your capstone project. So Anthony, if you want to move on to the next, thanks. So as part of OFIS, we really want to emphasize drawing connections between science and social justice for, I would say, basically practically any issue that you can think of that has some sort of a science component to it. There also is a social justice component to it as well. And that's something that you can think about sort of spotlighting as you work on your capstone. Of course, something that's also really important is thinking about what scientific methods that you will use. Anthony, thanks. And I would say this is probably most important in terms of thinking about how feasible answering your research question is. So if your research question requires that you, I don't know, if your research question requires that you survey 100 people, and you think that it is, for example, just too time consuming to survey 100 people, then probably don't suggest something that relies on that. And then very related to that is thinking about what information or what data you need. So for example, if you want to have a project that's based around how accessible healthcare facilities, so let's say that you're like, okay, my community, oh, thanks. Anthony, you can move on to the next one, thanks. So let's say that your community just doesn't have any hospitals nearby, but you do know that they do have a mobile health clinic, basically just something like an RV or a school bus maybe that's been outfitted to take people's blood pressure. and connect them with local hospitals, like help them set up doctor appointments, take their information. So let's say that you want to do a project that revolves around just collecting data from people who visit the mobile health van and looking at how the mobile health van helps people or doesn't help people in the community and what they can do better to better serve people in the community. If you don't really think that you can have that level of access to survey patients, which I would say is particularly a sensitive area, then maybe build your capstone project a little bit differently. And then you can maybe skip 2 bullet points and go on to the next slide. Thanks, Anthony. And so now we'll talk about what makes a good research question. And different people have different things that they sort of say. We have 4 main points on here. So number 1 is you want your research question to be original. And what that means is ideally, so this doesn't necessarily have to be the case, but ideally you want your capstone project to do something that nobody has really done before, right? Or do something that nobody has really done well. You want to do something that's new, that contributes something to your community, whether that's just your hyper-specific local community or maybe just something that's a little larger scale. So I would say definitely keep in mind that you want to try to do something as original as you can. And I mean, if you can't, like, that's also kind of okay. Next, I would say you want your research question to be clear. And this is a must, and we'll talk about some examples of what a clear research question is later. You also want your research question to be concise. And then you also want your research question to be measurable. And by measurable, what we mean is, we'll have examples of this later. You want your research question to be something that you can answer. So if you're curious about something and you can't really measure it, then that maybe isn't the best research question to have, and you should think about reframing it. And then another way to say measurable is just to say testable, which is, I guess, less common, a word that you will see used every day. Next, Anthony, thanks. So now we'll think about a research question, and we'll talk about whether it's good or bad or just what we can do to thanks. You can click next again, Anthony. Thanks. Okay, so here's an example research question. So let's say that you really care about climate change because climate change is an important issue. And so you want to ask, what is the effect of global warming on people? I really want you guys to interact with this. So is this a good or bad research question? And then why? Speak up or put something in the chat.
I feel like this research question is very vague because the concept of global warming is a very highly researched area. And I feel like specifically this question doesn't really emphasize something that the person is trying to research. I feel like if they really wanted to make this as a better question, would really just emphasizing it and making it more specialized to what they want to do related to global warming, whether it be the effects, maybe pollution, or maybe it's just in general, like in their community, it's getting hotter. Like, what do they want to tackle specifically?
Thanks, Sophia. I'm hearing multiple overlying themes that you're mentioning here. So if you remember, and yeah, I see somebody, Megan, doing the hand clap in chat. Totally agree. So of what we talked about earlier, your research question should be original, clear, concise, and measurable. Which of those 4 attributes do you think are sort of falling short here?
I think it's not measurable, like the person in the chat said, because
Thanks,
it's
Angelina.
not really testing anything. It's just asking
Okay.
what is the effect of global warming on people. It's not really warranting something that actually could be done to really improve this issue.
Thanks. Thanks, Sophia. Okay, let's hear some other thoughts. Musina, I saw you raise your hand up multiple times.
Oh, I was basically going to say what Sophia said. I feel like this research question isn't specific enough. And I feel like a more beneficial research question would be the effect on global warming on a specific area or community. Because if we're just talking about the effect of global warming, that could be anywhere in the world. And that's not really beneficial because, yeah, you're talking about the effect of global warming globally. But what about people in communities who might not have information about global warming or don't know the impacts of global warming. Things like that are factors that need to be considered when it comes to making these research questions. So I do want to agree with Sophia and say that it should definitely be more specific. I wouldn't say this research question is invalid though, because it's still to the point and it's still concise, although it can be more specific and less general.
Right. Thank you. Thanks. Yeah. So to sort of sum up quickly your point and Sophia's, the research question is lacking in sort of originality. People have been studying this a lot, and it is important, but you want to try to find a new angle to this if you can. The research question is also not super clear, which you might reword as it's not very specific, and that's also something that you would potentially want to change. And it's also not very measurable. So if you want to click next twice, Anthony, just to speed things up, one way that you can reframe the research question is to ask, how do rising sea levels affect coastal and economically disadvantaged communities in America? And also, honestly, probably to your point, Musina, you probably might want to select a community that's just a little bit more specific than this even. So New Orleans or wherever you happen to live. And thanks everyone for, oh, thanks Tess. That's a great point. Would you want to speak about it?
Yeah, I just wanted to say the question's also not really feasible if we're talking about the effect of global warming on everybody. We physically can't capture every single effect on every single person in the world. Like I mean, unless you have like unlimited funding and access. So yeah, just another thing to think about.
Awesome. Thank you. Really appreciate that. Thanks.
I'll
Okay.
also tag on that global warming is also an umbrella term. So like you can see that in the slides, it's changed it to sea level because that is a measurable like thing. Global warming is also very vague. Like you should pick one thing to measure that global warming impacts, or it will be impossible.
Absolutely. Thanks, Angelina. Thanks, Angelina. I appreciate that you mentioned that you definitely want to focus on something that's measurable and that rising sea levels is definitely more measurable. You can have specific numbers like, okay, it used to be, I don't know, 6 centimeters a year, and now it's, I don't know, 7 centimeters a year. Actually, those numbers are way too large, so this is just a completely fake example, but absolutely 100%. Thanks. And now we'll move on to talking about hypotheses. So what makes a good hypothesis? I would say a good hypothesis probably very similar elements as a good research question is number one, it's clear. Number two, it's specific. Number three, it's testable. Anthony, thanks. And so these are definitely things that you want to keep in mind across both research questions and hypotheses. And then if you click next again, there'll be an example hypothesis here that's global warming kills people. And I think that you can quickly identify many similar and many of the same issues here. So number one, is this a good or bad hypothesis and why? And maybe we'll just ask one person to comment here. Just one comment. Anthony, you can click next too. Thanks. Or okay, it's okay. I mean, you guys have already made abundantly clear that this, oh, thanks to Korea. You can speak up by the way, Korea, if you want.
I feel that it's not clear at all, and it doesn't really pull the point of how it could be measured. As we said, people, that's very vague, and so you can't really. Are we saying of all people? And so, how can you really measure that? And it's really not testable because a lot of things kill people. How can you say that just global warming, which is a very vague, um, very vague, what would I say that is? As she said, an umbrella of things. So like, how can I just say that that's the reason instead of being very specific? And it's not very clear on what you're really trying to get to of what are you really testing.
Thanks. And may I ask how did I say your name correctly earlier?
Yes, Aquaria.
Cool. Thanks, Aquaria. Awesome. So definitely, you mentioned all 3 points. Excellent. And now you can click next. Thanks. And so now we'll talk about a better hypothesis next again, which would potentially be that warmer temperatures increase the survival of disease-carrying mosquitoes. And actually, survival is potentially iffy in terms of how measurable that is. So maybe you would, maybe survival is maybe okay, I guess, but maybe another way to quantify survival would be the range of these mosquitoes, like how far north they can survive, or how far north you can find a certain number of them. And so now I don't know if we want, yes, I guess we can do one breakout room, I guess. So for now, we'll think about, you can just keep clicking next, I guess. So you should already have a topic that you want your capstone project to focus on. So we want you to definitely think about what social justice issue intersects with that, what science intersects with that. And then now we want you to talk about the stakeholders, and then you can click next again, Anthony. And we want you to think about what research question you might want to write. So if you want to work on a capstone that's maybe a bit research oriented, we'll send you to breakout rooms and you'll talk amongst just the people there about the research question that you want to think about, explore further for your capstone. Thanks. Okay, and then Doriana's just sent out an invite to breakout rooms. So we'll see you back. Thanks. Thanks. Welcome back, people.
All right, we'll give 30 more seconds for people to get back in. All right, I think that's everybody.
Okay.
Yeah. So thank you everyone for attending this meeting tonight. I hope you're able to have some pretty constructive dialogue with your breakout rooms just now. And I hope this also starts you guys to better ask those questions in regards to your stakeholders, your potential audience, and other members of the community around you that may be benefiting, funding, and maybe overall affected by the research that you're going to be producing during your OFIS experience. And before we let you go, some friendly reminders in regards to your just outputs at this point. So you must receive feedback and approval from OFIS on this part of your capstone before moving forward. When you're done, tag the email right there in your Google Doc and confirm Slack by tagging an OFIS staff member. The deadline has already passed for your modules at this point, and if you have not done so, please do so and as soon as you can. And also, if you are unsure about any questions or any other kind of comments that you might have, Caroline in the Slack channel will be there to answer them. Does anyone have any questions or comments about the presentation at this time?
Fill out an attendance tracking form. It's in the chat.
And thanks, everyone. Really appreciate the discussion and the insights and ideas that everyone shared. That's really, really good.
Yeah, you guys did a wonderful job. All right, and with that, fill out the attendance form, and I hope everyone has a wonderful rest of their evening.
Thanks, Ishan.
Thank you. Bye.
Thanks.
Thank you guys.
Thank you, Tess.
Bye.
Bye. Thank you so much. Bye.
Have a good night.